MPP Wayne Gates recently stopped by a neighborhood pharmacy in Niagara Falls to find out more about the National Healthcare Closer to Home initiative.
Well, what I'd like to say right off the hop is the NDP's been pushing this for a long time. When you take a look at my own personal situation, not just the Ontario government's situation, I've been using the pharmacies and an expanded role for a number of years. I get my flu shot sometimes at a pharmacy. When I've had health issues, and unfortunately, we all go through them as we get old. I would go and talk to my pharmacy and say, okay, what's going to happen with this medication? So I think it's important as the overall team part of keeping people healthy. As we continue to see, they may not be cutting dollars to healthcare, but the problem that what's going on in today is that they're not increasing healthcare dollars. So we've got to find creative ways to make sure that the limited resources that we have, we're spending them wisely. And one of those things, as part of keeping people healthy, is increasing the role that pharmacies are playing in the province of Ontario. And I believe it's a good thing. It takes some of the pressure off some of the doctors whose offices, you go to the doctor's office sometimes, you're there for an hour, hour and a half. Some of the emergency wards that are filled up. So I think to make healthcare more accessible, make it more affordable, pharmacies have to play a larger role, and I believe that the Ontario government is getting it right on this issue.
Tara, how has your role as a pharmacist changed over the last several years?
As a pharmacist, well, definitely we've become more involved with the public. Over the last few years, one thing that through our expanded scope of practice, we've been able to do flu shots. Last year was our first year in doing that here at our location. We've done over 200 flu shots last year to not only our own patients, but people that we maybe grab through the aisles as we're seeing them doing their shopping. So definitely that's one thing that has changed, other than our normal dispensing of prescriptions and counseling patients. So, well, definitely I know pharmacy as a profession is looking towards gaining more accessibility to different things that we can do. Right now, like I said, flu shots were one of the only things that we can do for injections, but by all means, travel injections, B12 injections were something I know that the profession is looking at. There are other provinces in the country that do actually have prescribing rights. It's something that maybe we would be looking at to become more accessible to the patient. That's the main goal. Healthcare for the patient, the easiest way for them to get better. And definitely that's hopefully something that the profession is looking at.
Cold and flu season is upon us, and if you're thinking about getting a flu shot this year, don't forget to think about visiting your neighborhood pharmacist. In Niagara Falls, reporting for The Source, I'm Lori Taraba.